Okay, to do self-mobilization techniques to the lumbar spine using the MyoTool, this is how we do it. Go ahead and lift up. You put the MyoTool on a towel while they're lying on the ground. He puts the MyoTool right in the center so the two center knobs are straddling the spine. And as he lifts up and down, he's creating specific joint mobilization techniques of a vertebrae on another. And in this case, he's probably at L3, mobilizing 3 and pulling 3 up away from L4 by going back and forth. He may move it up and down. Go ahead and go lower. So put the MyoTool lower. And now he lies there, and now he's mobilizing L5, S1, because he's right at the iliac crest. And so he can create deep, soft tissue work on the paraspinals and getting actually some intentional bone movement, which is nice. So he may work him all the way up, hitting all the joints through the lumbar spine as well as the thoracic spine in this position. The knees are bent to create a posterior pelvic tilt, which flattens the spine to allow for better movement. If it was a real acute case, he may just stay down, just slightly lift, creating just a slight little lift in mobilizing a joint, but not going through a large motion. If you stand up, go ahead and come up, and we put the spine down, this is what that technique looks like. The MyoTool is on the ground, the spine, the patient is lying down, and just lifting right here, you can see how it imparts a movement of one vertebrae on another vertebrae. And you can actually mobilize a joint downward, mobilize a vertebral body upwards by moving through, now let's pick it up and hold it there, by moving through these facet joints. That's where the MyoTool is sitting, over the skin and those deep muscles, the multifidi of the lumbar spine. Now, let's say we want to move one joint on one side. The next technique we'll show is the MyoTool coming under the body and just lifting on one side can impart a unilateral PA pressure. And it looks like this. Go ahead and lie down. The patient is lying down. We have a large ball for a more gentle technique or a smaller ball for a more specific technique. He's going to position it on the right side of his spine. He grabs the end of it. The left hand just guides the movement, and just by lifting up, he's doing a unilateral PA force on the left, probably L4-5 right now. There he is, right there, L4-5. He's pushing through those paraspinal muscles, doing a PA-directed movement. This, of course, would be wonderful for a patient with right-sided back pain, buttocks pain, any type of sciatica or radiculitis, radiculopathy. Mobilizing the joint for 20-25 repetitions. He may then stop and check out his straight leg raise to see if he can mobilize the nervous system further with less pain. If he can mobilize it further with less pain, he's on the right track of self-treatment for his specific lumbar dysfunction and radiculopathy or radiculitis. Thank you.